So this gentleman, Chris, he's a 49-year-old. He came from Liberia and he came with this problem in his left hip. Now he's a typical case in the sense that he had a problem called sickle cell disease. In this, the blood cells are misshapen because the hemoglobin is sickle shaped. So the blood cells, the RBCs are slightly misshapen. They're not actually kind of oval. So when these blood cells become misshapen, they can clog the arteries, they can block the arteries, they can then actually stop the blood flow to the affected part. In his case, he's been having these episodes of sickle cell crisis for far too long, for many years, and that actually damaged the blood supply to his hip bones, causing arthritis, avascular necrosis, and subsequently arthritis. Now, unfortunately, he also had an accident 14 years ago, because of which he had a fracture in his hip. Because of his typical condition of sickle cell disease, they could not do a surgery on him in his home country, and they just treated it like that with rest and medicines and all. Because the fracture united in a wrong position, he developed shortening of the leg by around almost 5 centimeters. And subsequently, he also developed bad arthritis. Now, when he came here, he was barely able to walk, barely able to stand. He had to use crutches in both his hands to walk or mobilize around the place. Now, because of his typical condition, he could not be straight away taken for surgery. First, we had to clear out his blood of all the damaged hemoglobin and the damaged blood cells. So that is done by a procedure called exchange transfusion. In this, almost all of the blood of a patient's own is exchanged by normal blood of his own blood group. And he got around 6 to 7 units of blood transfusion, which cleared out his blood and got the percentage of sickle cell blood cells to less than 20%. And when he came in, it was more than 76%. So we got it down to less than 20%. That decreases the risk factors and the chances of developing any sickle cell crisis during the surgery or after the surgery, and gives him a safe window in which he can do the surgery. So after this procedure, we could safely take him up for the surgery. He's had a very good result after the surgery. He started walking. His pain is completely gone. His leg is exactly the same length now. All of 5 centimeter shortening has been taken care of, and he is very happy with the result. So here he is talking about his experience to us.